Welcome to Joy in Our Town. I'm your host, Nick Kroger, and today we have the Clark doctors in the house. Dr. Roy and Dr. Danielle Clark, both chiropractors.
Yep.
Is that the doctor of DC is what?
Doctor of Chiropractor.
There you go. And we're going to talk about some interesting topics today. Dr. Danielle, with you, first of all, about just chiropractic care for the pregnant woman and the newborn infant, which I never even thought of that. And then we're going to get to you, but you chime in if you want to.
Definitely.
We're just very relaxed here. Talk to me a little bit. Let's just give an overview of the description of what chiropractic care is in general.
Okay. Dr. Roy is actually going to go into that because he's got the spine.
All right. Yes, this is my spine. No.
Yes.
Right.
As chiropractors, we look at your spine, and why your spine is so important is because it houses your nervous system. Now, these nerves come down through your brain. They come out at each individual level here. They go throughout your entire body. So these nerves control everything that you do, whether it's you walking down the road or digesting food. Now, your spine is normally supposed to move. It's supposed to bend. It's supposed to twist. But sometimes these bones can kind of get stuck out of place like that. And when that happens, that's going to start to irritate the nerves at that level. So wherever those nerves are going, that's where you start to notice things going wrong, whether it's back pain or indigestion or what have you, okay? So our job is to find those misalignments, make sure that we can line it back up so that it allows that nerve to function unimpeded.
Okay. Well, that makes great sense. Now, Dr. Danielle, you're going to tell us how all of what he just said pertains to the pregnant woman and why chiropractic care is so important for a woman when she's pregnant.
Absolutely. Not only chiropractic helps with the whole pregnancy, first off, even infertility, even before the woman gets pregnant. The biggest issue right now in the United States, or one of them, is that 1 in 5 couples have a major concern with infertility.
Right.
Now, in the spine, L3, which if you can point to it.
L3.
L3 right there actually correlates with the sex organs, and both male and female. And what that does is if there is an interference or the bone being misplaced or subluxation, it causes pressure on the nerve, decreased function to those organs. So with chiropractic, we adjust the spine back to where the normal alignment is, and therefore there's no interference anymore and the body can function properly. So it actually aids in increasing chances of getting pregnant.
It's amazing.
So that's even before the woman is pregnant.
Right.
Then all the changes that the body goes through. So the curve that's in the lumbar spine right on the bottom, that's the lower back, will actually increase as the pregnancy progresses.
Makes sense.
So it puts a lot of strain on the lower back. Now, that strain goes all the way up. So it's not just the lower back that we focus on with women. First trimester, we're worried more about, the neck. We tend to have headaches, nausea, all that stuff. But the pelvis, too, starts to have changes just as the baby grows. And so it's very important that, just keep the spine healthy. So
it's fascinating to me. As the baby develops, the pressure or the possibility for misalignment increases in a variety of areas within the spine and the pelvis. When you're treating a woman who's pregnant, you said in the first trimester, it tends to center more in the areas that actually, I'm learning as we go here, send nerve responses that deal with nausea and the neck pain that manifests there.
Right.
Talk us through kind of, as they get into that second and third trimester, what do you typically see? Where does the potential for problems lie?
Second and third trimester, most of the time it starts to be in the thoracic spine, which is the mid-back.
Okay.
And then again, when the baby, as it grows into the third trimester, which is the biggest growth of the baby, is at the end. And that's going to be more into the lumbar spine or the low back, and just because that weight comes forward.
It's amazing. And because up until now, I've thought, because you just shed a whole light on, chiropractor, we're out of place, we need to get in place. But it truly affects how, like you said, even the infertility before they're pregnant, how things function. And there's a whole lot more to it, I think, than the average person thinks. Am I right?
Right. Oh, yeah.
Well, tell me a little bit about the benefits of chiropractic care during pregnancy. Of course, we don't want a woman, as she's growing and progressing in her pregnancy, to be in pain, but I imagine there are a lot more benefits than just that.
There are. Of course, number one is we don't want them to be in pain.
Right.
But the other thing, too, is chiropractic has actually been shown to reduce labor and delivery times.
Okay.
Again, deal with the pain that comes up not only in the neck but the pelvis. Actually adjusting the pelvis, making sure that there is a proper alignment in it, actually helps the baby to get into the right position for delivery. So it actually aids in, unnecessary interventions like using forceps or vacuum or a C-section.
Well, that is amazing. And so I would, again, light bulbs are going off in my head because I'm seeing absolutely that would make sense. As they're getting ready to deliver, that the pelvic bones are already starting to move and shift, and so making sure they're in proper. Is the proper alignment for a pregnant woman in her third trimester the same as a proper alignment if she were not pregnant?
There's always a proper alignment to the spine, but the spine, when it's changing, there's a hormone called relaxin. Okay. So at the end of the pregnancy, it's very strong through the body. What that does is allow the pelvis to open up, and so the baby can descend. Okay. So it's even more important towards the end that the pelvis and the sacrum, which is that bone right in the middle of the hips there,
okay,
that those are the ones that are most important towards the end to be in alignment.
All right. That's where I have the most pain, right there. What about breech deliveries? Now, I can imagine, I'm thinking again as you're talking, and that involves something completely different. How can chiropractic care, is it giving the baby that proper descent if it's aligned, or talk to me a little bit about that?
Right. Well, there's different types of presentation. Normal vertex, which is head down, which is the regular, normal presentation for a baby to come out. There is breech, where the feet are first instead of the head. There's also transverse, where the baby's actually lying right across.
Wow.
And there is a technique in chiropractic called the Webster's technique. And what that is it actually allows the body to, when we adjust the pelvis, make sure that's in alignment. It actually allows the body the proper alignment for the baby to actually have enough room to turn. So we don't turn babies, but with this technique, it'll actually allow your body to do what it's supposed to do. The baby has enough room by working on the ligaments and the pelvis itself, and the baby just starts to turn vertex down or head down. And there's actually an 82% success rate with the Webster's technique. And it's non-invasive, it's comfortable for the mother compared to what the medical community uses, where they use an external rotation, where it's just pressure on the mom's belly. So it's very comfortable for the mother.
What are some of the misconceptions, someone watching that's pregnant, or, and you're smiling already, there are lots of them, I imagine, about, working or adjusting or giving a treatment to a pregnant woman. What are some of those misconceptions that I can't talk this morning, we can dispel now?
Well, I think one of the main ones is that they have to wait until they get adjusted. They have to wait until, second, third trimester. And if you find the right chiropractor who knows how and works with pregnant women, you can get adjusted from, like we said, infertility issues. So prior to conception all the way up until labor and delivery. And a lot of chiropractors, or some chiropractors, actually go to home births and adjust the laboring mom if labor stalls, and to help out with that. They can go to hospital births. We can help during the whole labor process. So most people just think that it's, we just wait till third trimester when the pain starts.
Right.
But we don't really care about the pain. We want to make sure that your pregnancy is healthy as possible.
And working ahead of that can possibly help alleviate pain, or the amount of pain, as your body changes.
Absolutely.
Well, let me ask you this, because I know that one of the topics I wanted to talk to you about was actually adjusting or giving treatment to a newborn. And I'm sure people are like, what? Because I had never thought of that. Talk to me a little bit about that, the benefits of it, and again, dispel any of those concerns that people might have.
Most people think of chiropractors as this rough technique that we use. And with babies, especially newborns, they don't have a lot of musculature in their neck. And that's why you always have to support the neck when you hold them. So when you adjust them, you literally use your pinkies, and it's just a little bit of pressure. And so there's no force, there's nothing in there. So, infants, the most trauma for them is birth.
Right. And
that's if it's natural, or any interventions, like I said before, forceps or vacuum or a C-section. Normally with a C-section, they, when they pull them out, it's kind of, they're holding by the back of their head, so there's a lot of torque on the spine. And even with a natural delivery, the shoulders move, they're trying to, or the head moves, they're trying to get the shoulders out. So there's a lot of strain on the spine. So we stress to have, newborns checked as soon as they're able to be. So either, at birth when they're, as soon as they're born, or even as soon as mom and dad can bring them in.
Amazing. And again, I hadn't thought about that, but just describing the way a baby is brought out during a C-section, or even just a natural, normal birth per se, there is that torque on the spine. Absolutely. And do you see a lot more now so than when maybe you were, in school or first starting, people bringing infants in for treatment and adjustment?
I do. I think people are becoming more educated and obviously want their kids to be as healthy as possible. We also see a rise in C-section rates. So with that rise comes more issues later on. So we just stress prevention more than anything.
Now I know that you're trained to be able to, know when you're dealing with an adult, they can tell you what hurts. But dealing with the infant, and you're saying just the smallest amount of pressure, even though their musculature is not, is very primitive early on, you can get a sense and a feel for what's out. I'm just trying to tap into you doing this. Right.
There's certain tests that you can do that the body will actually innately tell you what's wrong. So the baby doesn't have to say anything. Baby can't say anything.
Right.
So, there's certain tests that we can do that will show us which areas are more common than others. In newborns, especially when they're first born, they tend to have, common symptoms even, something as, simple as latching issues with nursing.
Okay.
Or ear infections or colic or reflux, which is the newest one now. And, even something like that, it all directly, like Dr. Roy said, that it all directly relates back to the spine. So those nerves that go to all those different areas, the ears, everything, it comes right from the spine. So we adjust the spine and actually, may help with the ear infections or colic or the reflux.
That's amazing. So back in the day, what everyone would just maybe say is a fussy baby, really could have been corrected or alleviated to some degree by an adjustment.
Possibly, yes.
That's amazing to me. I had never thought about young, but it makes complete sense. And so hopefully our viewers watching today are, having a light bulb moment that some of what they just think they have to endure, especially with a newborn, could possibly be, alleviated or at least modified.
Right. Well, it's hard with a new baby.
Right.
And especially one that could possibly have colic even. They're crying all the time.
Yeah.
You want them to be comfortable and happy, and happy mommy too.
Right. And viewers, if you're watching, she is a mommy of two, so she's not just talking as a doctor. She knows the benefits of it. Well, Dr. Danielle, we're going to give you a chance to talk a lot in this next segment, but thank you so much. I think our viewers really can grab hold, especially those that, the women out there that are pregnant and or trying to get pregnant. Or have that newborn, really enlightening, and I hadn't really thought of it, and I tend to be like the average Joe, so I'm assuming they haven't either. But we want to keep you both here, and I want to talk to you a little bit about auto injury and accident and how it relates to chiropractic. So viewers, don't go anywhere. We're going to be right back after this short break.